Morning, Dr. Steve. Since this is our first video, I thought we ought to lay some groundwork and set some expectations for what this looks like. This is the intent of this is for you and I to stay in touch as you move out to South Dakota to pursue some other opportunities. But I figure we might as well turn this into some content, and if we get a few viewers, great. If not, that's okay too. That's not the purpose of this. I thought that we would call this series Doctor and Patient, where you and I have some discussions about really what I want to focus on is some basics that anybody concerned about their health and wellness and really longevity ought to understand. We can dive into some topics. Hopefully we don't break any HIPAA laws unintentionally. You're the one trained in that, not me, so I'll leave that up to you. But just really discussing kind of some health benefits, health and wellness, and I've got a few agenda items to start out with. Number one is preventative health. You know, Peter Attia in his book Outlive talks about medicine 3.0, which is really preventative medicine, going to seek a medical professional not to diagnose a pain or a illness, but rather to help you optimize health and prevent those problems from arising. Things like getting a heart scans, working out in zone 2, cardiograms, blood work done, and kind of monitoring a lot of those health metrics or biomarkers to seek out longevity and optimal health. So my first question for you, Steve, is what are some of the basics that people should pursue in seeking to have optimal health? The ones that I focus on personally, I'll kind of dive into that. First and foremost, and I think this is widely recognized as the most important thing, is diet. I try to eat foods that have been around for over 100 years, foods that my great-great-grandparents would have eaten, which does not include things like Pop-Tarts or Reese's Peanut Butter Cups, which are some of my favorite things, but rather potatoes, meats, vegetables, fruits, legumes, beans, those types of things, seeds and nuts, and trying to eat those really to do 3 square meals a day. I do love snacking, and so if I do need to snack, I try not to seek out, the sugary treats or the soda, but rather something that, my great-great-grandmother would have picked while working in the field. Some peas, some watermelon. It's watermelon season right now, which is fantastic. We actually just harvested a lot of our strawberries and raspberries in the backyard, which, give you that kind of that sugar kick, that sweet taste in your mouth. So that's kind of what I try to do from a dietary basis. I do track my calories because I like to measure the protein and the fiber intake that I eat. I'm also just a habitual overeater. And so while calories are not a good indication of health, for me, it is a good indication of the amount of food that I consume in any given day or week. So again, it's just a little bit of a tool to help me kind of measure the amount of food that I'm eating. I think in a good day when I do end up or I'm able to just eat the 100-year-old foods, I think it's less important, the quantity of food I eat. But oftentimes, I've got a wife and 6 kids. We end up going out to eat. We end up eating whatever is available, those types of things. We like to have a snack before bed, which is probably not very healthy. So counting calories and looking at my protein and fiber intake does kind of help me to kind of measure the diet. The second thing other than diet is exercise. I try to get 45 minutes to an hour of exercise every day. Is that good? Peter Attia, I think, talks about 2 hours a day, which seems excessive to me, especially with a busy schedule. Other health professionals have different opinions, but I try to do that 45 minutes to an hour. I kind of try to switch it up between strength training and cardio. I think that muscle is healthy. I think as you grow older, muscle will deteriorate. And so the more you can get, I think the better to a limit, obviously. But I think cardio, especially in zone 2, kind of marathon training. Marathons are probably a little bit long when you're looking at health, but running, biking, those types of things I think are pretty healthy for longevity and optimizing health. I also try in the summer months, try to go on a walk every night, kind of a de-stress, kind of shake out the day, spend some time with Katie and the wife, just kind of decompressing. Which leads me to number 3. You got diet and exercise is 1 and 2. Number 3 is kind of preserve the mental health, keep stress to a minimum, spend time with family and friends, work-life balance, do some of the things that I enjoy, make time for hobbies, make time for interests and passion, but also really have purpose, seeking out the things that make me happy, seek out the things that I feel like have a higher meaning, a higher purpose. I'm very religious. Those things I think are undervalued when you're looking at health and longevity. And I think those things are very important. Also, I guess, so would love to hear from you from a medical perspective and your personal perspective. What should the average person do as kind of the basics for preventative health, for longevity, for wellness? And I guess my last question for you is thoughts on the blue zones. Assuming you've heard about this, there was a great Netflix documentary made and multiple books published about centurions that live in specific areas, geographical regions within the world, that there's a higher level of people that live to be 100. And I think some of these things have been highlighted as the cause for a long life. Do you think there's any validity in that? And if so, what are the specific aspects that you think may have more of an impact than some of the other ones? Those are my questions for you, Steve. Hope to see you soon. Hope to hear back from you. Excited to get this thing going. Talk later.